All right. Good afternoon. I'm David. Good to see you all here today. I'm glad y'all could join us. And I know that you've probably seen me bumping around here off and on. And you probably recognize this guy, Jim, who does occupational therapy. Susie has spoken here a couple times. She's from PT, and Zach and OT that also bumps around here quite a bit. So I just wanted to introduce us. And today we're just going to talk a little bit about what we do with functional transformations. That's who we work for, and how it can benefit you in PT and OT, and maybe we would find you as a patient at some point to help you out with some of the things that maybe you're struggling with. So anyway, today we're going to discuss a few things. The first thing we're going to discuss is the benefits of physical therapy and occupational therapy. Many of you have probably already experienced OT or PT at some point, and you're all at different points of your journey. Some may be new to Parkinson's, and some maybe have been living with it for several years. But PT and OT has become one of the three things that are used mostly for treating Parkinson's disease. So along with obviously the pharmacological with levodopa and also the surgical stuff. So anyway, the surgeries, brain stimulators. Thank you. I couldn't think of the word I was looking for. So, anyway, no doubt many of you have already experienced time with PT and OT and speech therapy. So we just want to add our little take on what we can do for you to help you with things. So anyway, some of the benefits of formal PT and OT are we want to look at the benefits of exercise outside, which is something we don't always think about. So you do your PT and OT, and how many of you have actually been through PT or OT? Yeah. And sometimes we find that afterwards, after you finish PT, formal PT, you find yourself kind of stepped back a little bit after you've stopped doing the PT. And that's a big concern for us because we want you to succeed, right? So I want to talk to you a little bit about that at some point. And obstacles you may encounter with your formal PT and OT, and the Medicare coverage and insurance coverage, which is everybody's question usually, is like, is this going to be covered? So anyway, so the formal benefits of PT and OT, most PT for this one is gait. One of the big things that people have problems with is they stop doing what they would normally be doing because walking has become an issue. And have you all experienced that? I'm not sure if I want to do that because it's a little bit hard to get around. So we can help with that through our treatments.
And one of the things that we're going to do is that we are going to evaluate how you move. In that way, we're going to find out what things we need to tune up, because everybody's different. You may need to get a little bit stronger. You may need to get a little bit more flexibility. You may have encountered some problems now going up and down the stairs, and you figured that out because you went to visit family up north. Then we're going to actually look on all that to make your movement easier and to have the freedom to do things without thinking about, oh my goodness, I don't want to fall, I don't want something bad to happen. And walking is not simple walking. Walking is moving, is doing other stuff. We take it for granted. We walk, but we are thinking of something else, and that is that dual tasking thing. And we have two programs that they are kind of like the standard for Parkinson's, which is the LSVT program and the POWER program. And they are very effective, but we also want to make sure that whenever you go through this program, that you keep actually doing exercises. And I think that this is one of the things that we encountered that problem. You go to the program, and then after 3 months, you get tired of that particular program. And this is one of the things that we tailor, that we start changing things a little bit to keep you moving. Because the important part is keeping exercises, keep it moving, and make it functional.
Yeah, your functional, oh, sorry. Thank you. Your functional mobility is also going to include walking in crowds, walking or car transfers, sit to stand transfers. So how many of you recognize this? When you sit down, you swing to sit down. That's Chuck. That's a common, but it's an unsafe practice. And so what we do is we work through some of these functional mobility things, and Zach and Jim both do this as well, is we work on sequencing to get you to follow a certain sequence of movements every time to make it safe for you. So we try to break the habit of doing things in a unsafe manner and get you to do things in a sequenced manner every time to make it your new normal. Wasn't me. All right. How about strength and flexibility? Either one of y'all want to talk about strength and flexibility?
So, with Parkinson's, the individuals with Parkinson's tend to get tight and draw up. So what we're going to do is work on that core and free up that core, get you stretching, get you rotating, get you twisting, get you bending. Because how many of you can't even tie your shoes here? So that's one of the things we're going to be working on, is getting your mobility so you can twist, turn, roll in bed, move around in bed. Because one of the biggest things I've seen is the bed mobility. When I go to people's houses and I do their evaluation, first thing I do is I take them straight to the bed and see how they can roll in their bed, how they can scooch up in their bed, how they can get out of their bed. And so all that comes with your trunk, your rotation and everything. If you get all tight and weak in the trunk, you're not being able to roll, you're not being able to twist and turn. And so getting that flexibility back is going to make it so much more beneficial. And then hamstrings, getting those hamstrings stretched out. Almost every one of you guys, I guarantee you, has a tight hamstring. Almost everyone. So getting you stretched and moving is like key. And the strength.
And the posture is very important for balance, because if you don't have a good posture, you cannot control your balance. And you need to think about when you're walking, if something surprises you, or if you're reaching, that you're reaching for something and then you go and fall over. And we definitely work on that.
So, sorry. Speaking of posturally, it's like where your head goes, that's where your body goes. Have you ever found yourself feel like you're moving and you're speeding up as you go? And a lot of times what I find, and I work with my people, I tell them where your head goes, that's where your body goes. So if your head is here and your balance is already compromised, when you start to feel that feeling, it's going to increase. So by working on your posture and getting you up straight and stronger upper body, then we can, and more flexible in your chest, we can help you to have less risk of falls, and your walking can improve as well.
And the risk of fall is very important because we want to improve the quality of life. And doing the exercises, working with posture, working with balance, is going to help you to keep independent, because this is what we want. And talking about quality of life is not only physically, but also mentally and emotionally. Exercises will help you with your mood. You will be less depressed. You have less apathy, because you will feel like, okay, I can handle my environment a little bit better. I'm going out with my friends to go to the restaurant. I'm not worried so much like, oh my goodness, it's going to take me forever just to get to the table. Or what will people think whenever I cannot get up off the table after having dinner? then all this stuff, you keep moving and you keep active, it's going to make a big difference in your life. And we want for you to be able to do things that you love to do, whatever that is. If it's playing golf, if it's playing tennis, or it's just going up north to visit your family. And the most important part, I think, that we're going to do your home exercise program according to your needs. It's going to be personalized to you. Even though we use the LSVT or the power, we have this component that will be specifically for your needs.
And one other thing about our therapy, it's all one-on-one. We don't treat two people at the same time. All of our therapy is one-on-one. So you get the quality one-on-one time, because I can guarantee you guys have all been to a place where they've lined you up and had multiple people working at the same time. We don't do that. It's all one-on-one individual treatments. And if you've had them already, you already know that.
It's one-on-one, and we also encourage the caregivers to come because, you know, they're your greatest advocate and they're our best help as well, because as we're trying to teach you new patterns of doing things, they're the ones that recognize when you're not doing those things. So we love to have your caregivers or spouses or whoever is with you on a regular basis that is interested in your care to be there, because they can be helpful to us as well as to you. So we would love to have them there. They also learn the home exercise program. So not all of the exercises that we give are like the LSVT, which is 7 exercises and sit to stand. By the time you finish 4 weeks, you better know those 7 exercises. I guarantee you're going to know those exercises after you finish 4 weeks, because you're going to do them a million times. And that they are really great exercises. I'm not trying to belittle them. We use them all the time. But some of the exercises are once we start to working on your balance, they're a little bit different. They're a little bit harder. They're a little bit more, they require a little bit more challenging on your part. So it's good to have somebody there to help you out with that.
And the other part I wanted to say about, we talk about balance and we want to prevent falls, but we also work on the fact what happens if you fall down. We will work on floor transfers, because we are trying to see you as a person, okay? From getting up to going back to bed, like functioning. We think about all the stuff that will affect your environment, and we'll include that, okay?
And we include dual tasking, which we've talked about. Sometimes doing something like just as simple as carrying a tray and stepping backwards to put it down or something. Something like that can cause a freezing of your gait. And so we help you to work through some of those issues that you might be having. So again, it's personalized to you. So if I find what your triggers are, what triggers your freezing of gait, I'm going to make you do that over and over, and we're going to work through it until we can figure our way through it. So then when you approach a threshold walking, you don't freeze. Or you approach a curb coming up, you don't freeze. And you're able to continue on through with the normal gait pattern. So that's very important because that's one of the leading causes of falling, is whenever you do freeze and you're trying to get out of that freezing. I've had people fall backwards. That's why I said carrying a tray. He was carrying something out of a refrigerator and just his feet were stuck. He couldn't step backwards to get away, and so fell backwards. Those are the sort of things we'll ask you questions about, and we'll figure out what's personal to you, because everybody's trigger can be different. So,
no, I want also to talk a little bit about not only the physical part of the not being able to move, of having balance problems, but also if you are doing exercises, you keep active, it's going to improve your sleep, it's going to improve your memory, and exercises not only help you to move, but also help you with your nerve. Helps you to keep your nerve healthy, decrease inflammation on the nerve, and also help you to kind of keep your nerve working better. And I think that sometimes we overlook that, and we can overlook that because exercise is very, very positive for your quality of life.
Unknown caller. So one of the parts I talked about earlier was the need to continue PT afterwards, or some sort of therapy, exercise during and after therapy. The Parkinson's Foundation recommends you do 2.5 hours or more a week of physical activities to maintain your quality of life. That's where the places like this are so awesome. You guys have so many opportunities to engage in activities outside of physical therapy. So if you came to physical therapy, I would still recommend, hey, go and do the boxing class or go and do the spinning class, because those are all going to help augment what we're doing with you and to help you to progress. And it also helps kind of get you on the path to, when you're discharged, you're already doing activities that are going to help you out. You want to say? Yeah? You want to say something?
One thing with outdoor activities and occupational therapy, the benefit that we have is we can work on certain things. So, for instance, your leisure activities. Say you like to golf. If you like to golf, but Parkinson's is affecting your ability to golf, we can work on those functional components that tie into golf so that you can then continue with those activities as well.
And we can even have you bring a golf club in and actually work on that swing, because that's part of it.
Yeah. And it all comes together right back to what the first one was, flexibility and strength. You
And
have to have the
balance.
trunk flexibility
Balance.
and the balance and the strength to be able to do that. So it all comes together, and we want you to go out and be able to do your activities. And so we'll take that into account as we form a plan for you, for your specific issues or desires. So here are some of the things that are obstacles that you might encounter. Fatigue. You're going to get tired, especially if you're doing some of these things like LSVT. You know that you're going to, when you finish, you're going to be, after that hour session, you're going to be wiped out, because amplitude we want you to work at a really high level. And so that makes that exercise really hard for you. So if we had a scale of 0 to 10 and 0 is zero effort and 10 is maximum effort, I'm going to encourage you to work through those LSVT exercises at like an 8 or 9 or a 10. So by the time you finish, you're going to be fatigued. But it's been found out that working at that higher level helps you to get better faster and to get those movements more into your body. So motivation, we've already talked about, sometimes people are just not motivated, and I understand that. I have a hard time going to the gym. So it's hard for me to preach on that one, but on and off periods of your medicines. So if you are at a lower, at the end of the medicine, it's going to be harder to do those exercises. So muscle soreness, yeah, that's going to be one, especially if you come and see me. I'm sorry, sometimes people will accuse me of that. But pre-existing medical conditions. And this is another thing that all of us have to deal with, is we treat you the way you are. It's not just your Parkinson's that we're dealing with. If you have low back pain, we have to work through some of that. If you have joint problems or joint replacements, arthritis in your shoulders, we'll have to modify some things. And that's fine. That's what we do. So don't be discouraged to do physical or occupational therapy just because of other issues.
And something important is that we are therapists. We are not only for Parkinson's. Right here alone, you have like 60 years experience right here. Then we think about if you have back problems, shoulder problems, we will help you with all that too, okay? Then don't feel that you're alone on that part, that we just only do the Parkinson's part. You want to skip that one?
Yeah, skip that.
Oh,
Here we go. This is the one. I don't know. I always tell people the same thing. I don't know. It's not my wheelhouse. I don't deal with finances, but thankfully we have people here that know a little bit about it. I just like to treat you guys. You come in and I interact with you, but when you ask me questions about insurance, just know I'm going to say I don't know. Yes.
And the best thing when it comes to if you have traditional Medicare Part B, that's typically going to pay the 80%. It all depends on what supplement plan you bought. If you bought a cheap supplement plan, we can't guarantee, we always have to tell, we can't guarantee Medicare is going to pay, the supplement's going to pay their 20%, because it all depends on the plan you got. It all comes down to the plan you got. I used to think it all paid every 20%, but this last couple of years, I've been taught different. I've been taught a lot different and everything, but 95% of the time they do pay. But there's those few plans where you got 10 visits or 20 visits and everything for your secondary, your supplement plan. So that's the best thing I could tell you is 95% of the time, it's going to cover 100%. It's just that 5%, we just never know on that plan. There's no way for us to ever know. Unfortunately, there's just the unknowns. Yeah, we submit to insurance. Medicare audit, once we bill Medicare automatically forwards it on to supplemental. And then we do see, we take Advantage plans too. So we take Florida Blue PPOs. We can only do PPOs because we're out of network with all the insurance plans. And the reason we're out of network is we do one-on-one treatments. If we got into network, we wouldn't be around. Because when you're in network with an insurance company, for example, like United Healthcare, they want to give like $50, for example, per visit. Well, when I'm paying my therapist more than that $50 per visit, we won't be around. So we have to stay out of network in order to give the quality services we do. So most plans like Florida Blue, United Healthcare, Humana have low out-of-network cost when you're on the Medicare. So it might be $10 to $40 a visit, depending on which plan you got. Now, Aetna is the one that has changed this last year. Aetna really threw a curveball at everyone last year. Now, if you have an Aetna retirement plan, those are fantastic. Any retirement plan is going to pretty much will be fantastic. It's the non-retirement plans of Aetna that they're only paying 50%. And it makes no sense to us. We just have to deal with what they dealt us last year. Up until last year, they were paying what the others were paying. But Aetna last year decided to go out on their own and be strange when we're out of network. So, and we've even tried getting in network with them just to see if that helped, and they're not even opening their network plan. So Aetna, now, if finances are an issue, we do have the luxury of working with the patient, especially with like the Aetna plans. Aetna's plans always say that we have the luxury, if finances are an issue, we could take those finances into consideration and decrease the co-insurance so you can afford to do it. That's one thing. Anyone knows me, I'm always about helping people out. I teach a Parkinson's class. I bought so many things in here for the Parkinson's people, so I'm all about helping people. This isn't about making money for me. This is about helping people, and any of my employees that work for me knows that's what comes down to it. Foremost is helping the people out.
And I wanted to, this question comes a lot because other conditions like back pain, neck pain, shoulder surgery, knee surgery, you have a budget for therapy that would be a speech and PT of $2,300 a year. But that doesn't apply with the Parkinson's diagnosis. Kind of that makes sense? Then it's totally different. You guys, because of the Parkinson diagnosis, you don't follow that budget rule. But,
Medicare lost a lawsuit about 15 years ago.
go ahead.
Medicare lost a lawsuit about 15 years ago. An individual with Parkinson's sued Medicare and basically went, we're not going to get better. We have Parkinson's. There's only so much we can get better. So with Parkinson's is one of those conditions where you don't have to always show improvement. As long as you're maintaining, we can continue with Parkinson's, and there's really no limit with the Parkinson's. Now, we're not going to continue with someone forever on Parkinson's. There's times where you just need to take a break.
And this is the important point. It's like you need to be compliant with your home exercises because therapy services is not personal training. And we need to be responsible in how we use our resources. Then you will go on therapy, we help you with all that skill to tune your body up, to give you tools to be able to manage and keep decreasing the process of the disease, but you also need to be responsible doing your exercises, okay? And this is what whenever you come to see me, I will get some different tests before and after to show the insurance company you're a little bit better or just staying the same, but we always show some kind of progress because at the end of the day, it's quality of life. This is what we want. They can go.
Huh?
OT.
Jim,
Yep.
this is you. This is the fine motor stuff.
So fine motor and coordination is very important. As you guys would go to our fine motor class that we do here, the fine motor is being able to button your buttons up and stuff like that. So if you struggle doing stuff like that, we're going to work on those type of activities. So like if we do therapy with you and you're worried about, hey, is he safe in the shower? We can always go to your house and make sure your shower's safe, make any recommendations for grab bars, shower chairs, the appropriate shower chair, bed rails for your bed. How many of you in here have bed rails for your bed that you use to get in and out of your bed? That's like one of the most important things for probably 90% of my patients I've had for Parkinson's. They struggle getting in and out of their bed. And that little half bed rail that goes at the top of the bed can make all the difference in the world. And you can get them on Amazon for $35. It's one of those things that doesn't cost a lot of money and can make such an improvement in people's ability to get in and out of bed, and even something to stabilize you when you first get up in the morning. Because how many of you are steady when you first get up in the morning and you get, instead of having that walker that can fly away from you, you've got something that's stable to stabilize yourself. Then just making sure you can do what you need to do for yourself. If you're struggling getting your shoes on, we're going to give you modifications. You're struggling opening a jar of pickles or anything like that. There's so many things over in that little cabinet over there that can make your life a lot easier. Button hooks, car grab bars, jar openers, can openers that are all adaptive for individuals with Parkinson's.
All right, that's it. So, bottom line is, we can help you if you need helps with ADLs, with your balance, with your gait, whatever issues you're having, we can address them with you, and we would love to have that opportunity to get the most out of your PT or OT. Make goals. Participate in your home exercise. Come to your classes. Come to your sessions. And most of all, don't give up. So I think you've probably all heard it. On this last thing I'll say, you've probably all heard it said before. I have Parkinson's, but Parkinson's doesn't have me. So just Don't give up. And we're here anytime that you need us. And we're all around this clinic. So if you, or this place, so if you need us, stop and talk. All right. Thank you for having us today.